Hey Psych Circles community. Have you ever encountered someone who seemed overly self-absorbed, manipulative, or lacked empathy? Relationships are at the heart of it all, and when strained by Narcissistic Personality Disorder, NPD, things get complicated. NPD is much more than just being self-centered, it's a serious mental health condition. Today, we're diving deep into what NPD really is, beyond the stereotypes, and exploring its symptoms, causes, and treatment options. Whether you're curious about this disorder, suspect you know someone who may have it, or are just passionate about mental health, this video is for you. So let's get started. Narcissistic personality disorder isn't just about loving oneself too much. It includes a grandiose sense of self-importance, a constant need for admiration, and a lack of empathy. For someone with NPD, the need for validation is constant and all-consuming. This lack of empathy can make relationships incredibly challenging. Imagine living with someone who constantly needs to be the center of attention and can't handle criticism. By understanding the underlying causes of NPD and the treatment options available, we can help those suffering find a path towards healing. Breaking down the stigma surrounding this disorder is crucial. There's hope for healthier relationships. Let's dive into the core characteristics of NPD. First, grandiosity, an inflated sense of self-importance. Someone with NPD believes they're superior and deserves special treatment. Then, the constant need for admiration, like an addiction. Without praise, they can become anxious or enraged. Finally, the lack of empathy, the inability to understand and share the feelings of others. This can manifest as being manipulative or exploitative without remorse. Recognizing these traits is key to understanding NPD. Grandiosity is more than thinking you're great. It's a belief that you're better than everyone else. Someone with NPD might exaggerate their accomplishments and expect preferential treatment. This grandiosity serves as a defense mechanism against deep-seated feelings of inadequacy. The grandiose facade masks their vulnerability. It's a fragile ego built on shaky ground. Any perceived threat can shatter this persona, leading to anger or rage. The insatiable need for admiration is like feeling empty inside. They crave compliments and attention like oxygen. Social media can exacerbate this need, creating a distorted sense of self-worth. This need for admiration can be exhausting for those around them. No matter how much praise you give, it's never enough. When admiration is threatened, it can trigger intense anger and jealousy. How do NPD characteristics play out in daily life? Exaggerated self-importance shows up as needing to be the center of attention. The need for admiration manifests as fishing for compliments and seeking reassurance. Lack of empathy can be the most hurtful symptom for those around them. They might dismiss others' concerns or take pleasure in their pain. These behaviors signal something deeper is going on. Building a healthy relationship with someone exhibiting NPD behaviors is challenging. Relationships often become casualties. It's like walking on eggshells, never knowing what will set them off. People with NPD often have unstable relationships, cycling through partners or friends. They might isolate their partners, creating a dynamic of control. Until they recognize the problem and seek help, those around them will bear the brunt of their pain. When the mask slips, vulnerability and rage. Despite seeming invincible, their fragile ego can shatter easily. Criticism can trigger intense feelings of shame and inadequacy. They often respond with anger or by lashing out. Setting boundaries is crucial when dealing with someone with NPD. Don't engage in arguments, it will only escalate the situation. The world revolves around me, entitlement and exploitation. A sense of entitlement is a hallmark of NPD. They believe they deserve special treatment and might exploit others. They might use manipulation or deceit to get what they want. This sense of entitlement can lead to exploitation without remorse. They might take advantage of others, leaving a trail of destruction. The roots of narcissism, nature, and nurture. What causes someone to develop NPD? It's complicated. It's a combination of genetics, environment, and psychological factors. These factors interact in countless ways, making it difficult to pinpoint the exact cause. Understanding these contributing factors is crucial. We'll break down each factor to understand how NPD develops. The genetic hand we're dealt predispositions and personality. Genetics plays a role in shaping our personalities and vulnerabilities. There's no single narcissist gene, but genetic predispositions can increase the likelihood of developing NPD. These predispositions don't guarantee NPD but can make someone more susceptible. Combined with other risk factors, they can increase the likelihood of NPD. Understanding these predispositions helps us approach NPD with empathy. Childhood's enduring impact, upbringing and the development of NPD. Childhood experiences, particularly within the family, play a huge role in shaping who we become. Early relationships with caregivers lay the foundation for how we see ourselves. Neglect, abuse, or overindulgence can create a sense of insecurity. Excessive pampering can lead to a lack of empathy and humility. These experiences can contribute to the development of NPD. A perfect storm. When genetics and environment collide. Genetics and environment converge to create the conditions for NPD. A genetic predisposition combined with a challenging environment can exacerbate vulnerabilities. This combination can make it difficult to develop healthy coping mechanisms. Despite these challenges, there's always hope. With the right support and therapy, individuals with NPD can build more meaningful relationships. The doctor is in diagnosing NPD. Diagnosing a personality disorder requires a trained mental health professional. It's not as simple as checking off a list of symptoms. A proper evaluation considers the severity and impact of symptoms. Diagnosis is about understanding and finding the right treatment. If you're concerned, reach out to a qualified mental health professional. DSM-5, the gold standard for diagnosis. Now, when it comes to diagnosing mental health disorders, there's a sort of rule book that clinicians use, a comprehensive guide to help them make accurate and consistent diagnoses. It's called the Diagnostic and Statistical Manual of Mental Disorders, or DSM-5 for short. This manual outlines specific criteria that must be met for a diagnosis of NPD, or any other mental health disorder for that matter. It helps ensure that diagnoses are standardized, meaning that a therapist in New York and a psychiatrist in California will use the same criteria when evaluating a patient for NPD. So what does the DSM-5 say about NPD? Well, according to the manual, someone must exhibit a pervasive pattern of grandiosity, need for admiration, and lack of empathy, beginning in early adulthood and present in a variety of contexts. And here's the kicker, they also need to meet at least 5 out of 9 specific criteria, which include things like having a grandiose sense of self-importance, being preoccupied with fantasies of unlimited success or power, needing constant admiration, having a sense of entitlement, and taking advantage of others. Beyond the label, a comprehensive assessment. Now, just because someone meets the criteria in the DSM-5 doesn't mean the work is done. Diagnosing NPD or any mental health condition isn't like taking a blood test where the results are clear-cut. It's a much more nuanced and individualized process. A good mental health professional will take a comprehensive approach, considering the individual's unique history, experiences, and current life circumstances. They'll want to understand the full picture, not just focus on a checklist of symptoms. This might involve conducting clinical interviews where they'll ask about the individual's childhood, relationships, work history, and any other relevant experiences. They might also use psychological tests or questionnaires to assess personality traits, emotional states, and coping mechanisms. And in some cases, they might even want to talk to family members or close friends, with the individual's consent, of course, to get a broader perspective on their behavior and how it's been impacting those around them. It's like putting together a puzzle. The DSM-5 provides the framework, but it's up to the clinician to gather all the pieces and assemble them in a way that makes sense for that particular individual. The path to healing treatment options for NPD. Now, I know what you're thinking. Can NPD even be treated? These folks seem pretty set in their ways. And it's true, treating NPD can be challenging. It's not like flipping a switch. It takes time, commitment, and a whole lot of hard work, both from the individual with NPD and the therapist guiding them. But here's the good news, it's not impossible. While there's no magic cure for NPD, there are effective treatment options available that can help individuals manage their symptoms, develop healthier coping mechanisms, and build more fulfilling relationships. The key is finding the right approach, one that addresses the unique needs and challenges of the individual. And that's where a qualified mental health professional comes in. They can assess the situation, develop a personalized treatment plan, and provide ongoing support throughout the process. Now, treatment for NPD typically involves a combination of approaches, including therapy, medication, and lifestyle changes. And in some cases, family therapy can also be incredibly beneficial. Therapy's toolkit, addressing the root of the problem. When it comes to treating NPD, therapy is often the cornerstone of the treatment plan. And there are several different types of therapy that can be effective, depending on the individual's needs and preferences. One common approach is cognitive behavioral therapy, or CBT for short. CBT focuses on identifying and changing negative thought patterns and behaviors. It's like rewiring the brain, teaching individuals to challenge those distorted beliefs about themselves and others that fuel their narcissistic behaviors. Then there's dialectical behavior therapy, or DBT, which is particularly helpful for individuals who struggle with emotional regulation, a common challenge for those with NPD. DBT teaches skills for managing intense emotions, tolerating distress, and improving interpersonal relationships. Another approach is psychodynamic therapy, which delves deeper into the unconscious processes and early childhood experiences that may have contributed to the development of NPD. It's about uncovering those root causes and developing a deeper understanding of oneself. Section 3. Beyond talk therapy, medication, and lifestyle changes. Now, while therapy is essential for addressing the underlying thought patterns and behaviors associated with narcissistic personality disorder, it's not always enough. In some cases, medication might be recommended to manage co-occurring conditions like anxiety, depression, or mood swings, which can exacerbate NPD symptoms. It's important to note that medication doesn't cure NPD. It's not a magic pill that suddenly makes someone less narcissistic, but it can provide relief from some of the distressing symptoms that often go hand in hand with NPD, making it easier to engage in therapy and work towards lasting change. And just as important as therapy and medication are lifestyle changes. Things like regular exercise, a healthy diet, enough sleep, and stress-reducing activities like meditation or yoga can have a profound impact on mental health, making it easier to manage emotions and cope with challenges in a healthy way. Helping someone with NPD. Loving someone with NPD is challenging. It's like walking on eggshells. You might feel trapped or hopeless, but you're not alone. Millions face this, and there are ways to cope. Understand you can't change them. Set boundaries to protect yourself. Learn to say no and prioritize your well-being. Seek professional help if overwhelmed. Section 1. Finding hope. NPD is treatable. Look, dealing with narcissistic personality disorder, whether it's your own struggle or you're trying to support someone who has it, can feel like an uphill battle. It's a tough journey, no doubt about it. But I want you to hear me loud and clear, there's always hope. NPD is not a life sentence. It's a treatable condition, and with the right help, individuals with NPD can learn to manage their symptoms, develop healthier coping mechanisms, and build more fulfilling, less destructive relationships. The key is early intervention. The sooner someone with NPD acknowledges they have a problem and seeks professional help, the better their chances of making lasting changes. And that's where you come in. If you recognize these signs in yourself or someone you love, don't wait. Reach out for help. Talk to a therapist, a counselor, a trusted healthcare professional. There's no shame in seeking support. In fact, it's a sign of strength. It means you're willing to face those challenges head on and take those first steps towards a healthier, happier life. Section 2, you're not alone. Resources and support. Facing a mental health challenge like NPD can be overwhelming, but remember, you're not alone. There are countless resources to help you. Start by reaching out to your primary care physician. Search online for therapists specializing in NPD. Support groups can be incredibly empowering. There are online forums, support groups, and hotlines. Reaching out for help is a sign of strength. Reach out, connect, and remember, there's always hope.